Please keep in mind that what you see in this video is conducted more slowly than it likely is in reality. This is done simply for educational purposes.
Typically we do this outside the room for space, but for filming we're going to do it inside the room. We have a patient here today. His name is Mr. Covey. He's 60 years old, and we've already made the decision that we need to intubate this patient. And we're going to do so in the emergency department as the ICU is full. I would pre-brief the team and simply say, all right team, we have a 60-year-old gentleman here, known COVID-19 positive, who's in severe respiratory distress and needs intubation. Notify the appropriate teams that we need. So if somebody could page ICU, anesthesia, and notify our T, please. All right, so my name is Angus. I'm going to be your team leader today. We need to establish our roles. So I'm going to need 3 people in the room, one being myself as team lead. I'm going to need an airway nurse, and I'm going to need a primary intubator. We need 2 in the ante room, 1 person as a secondary intubator, and another as a second RN that'll be ready to come in the room if needed. Outside the room, we'll have a runner and a spotter who's already out there and ready to go. And lastly, we'll have a second RT outside the room today. That'll be Natina in case we need anything. And they'll also come into play to be our clean team for transport to the ICU.
During this clinical scenario, we are trying to minimize exposure and maximize safety to our team. Therefore, only 3 team members enter the negative pressure room. These include the team leader, the primary intubator, and the airway nurse. These team members are all donned in airborne precautions. Also donned in airborne precautions are the secondary intubator and the second RN positioned in the anteroom. The spotter serves a very important role in spotting both the donning and doffing of PPE. They also run to get extra medical equipment if needed. The secondary RT also serves as a potential runner for airway equipment.
So again, briefly, we have Lacey's our primary intubator today. She's our respiratory therapist. We have Jacqueline, one of our nurses today, who's going to be our airway nurse in the room. I'll be team lead. Natina's our RT, our second RT outside the room in case we need anything. We have Guylaine, who will be our second RN in the ante room. And we have Mike, who's our secondary intubator in the ante room. You'll notice today that we're all in a mix of scrubs and street clothes. We're only going to don PPE on one individual today, and that's very much in keeping with we're trying to be stewards and stewardesses of PPE use, and we don't want to overuse. So for today's simulation or today's video, Lacey, our primary intubator, will be in PPE, but the rest of us will just stay in scrubs and or street clothes. Secondly, we're not going to use N95 masks in this video. Again, we're trying to preserve PPE, so we'll use a surgical mask instead. So at this point in time, we've established our roles, we know what we're doing, we know where we are, and now we want to prepare our team. One of the best ways to do that is with checklists. So we've actually developed an airway checklist and a nursing checklist to go along with our team command sequence checklist. This is a highly risky procedure, especially to us as healthcare providers, and every effort has been taken to ensure our safety. Checklists can help reduce cognitive load in that fashion. So at this point in time, as team leader Lacey, I'm going to give you our airway checklist. I'm going to ask that you go through it, ensure that we have everything ready to go. We've divided it into inside the room, what needs to be in the ante room in case we need it, and what can be outside the room in case we need it. All trying to minimize ins and outs between our ante room and our negative pressure room. I'm also going to give our nursing checklist to Jacqueline to ensure that she has what she needs for IVs, phlebotomy, and drug purposes.
What you see in front of you is our protected airway checklist for COVID-19 patients. Checklists allow for cognitive offload between team members and within the team itself during resuscitation. It also acts as a safety net to reduce error in team preparation and thereby reducing error that may come to the patient.
All right, Lacey, so I just want to go through and confirm that we have what we need for our airway equipment.
Yes.
So, do we have either a McGrath or a GlideScope Go?
Yes.
McGrath back check?
Yep.
We have our airway bag that's pre-made.
Yes.
We have something, an Untitled CO2 adapter.
Correct, right here.
Perfect. Our suction setup.
It's in the room.
Perfect.
Yep.
And we've got wipes in the room.
Yep.
We have a walkie-talkie. We have one set aside to come in the room for us. Perfect. And your RSI dump kit.
Right here.
Excellent. In our ante room, we have an eye gel in case we need it.
Correct.
And we have our front of neck access kit
Yes.
for surgical airway.
Yes.
Great. And outside our room, we have our airway cart.
Yep.
Yes.
Yep.
And we have our ambuscope.
Yes.
Excellent. And we have direct laryngoscopy in case we need it.
Correct.
And the ventilator is already in the room.
Yep.
Excellent. So we've confirmed our airway checklist. Move on to Jacqueline for nursing.
Just like our airway checklist, our nursing IV checklist provides cognitive offload to our nursing staff. Our advice is to modify checklists for your own specific department. We will provide links at the end of this video to all of our checklists and documents that we use so that you can access it and potentially modify it for your own work environment.
So for inside the room, Jack, we have our IV bag
Yep.
pre-made.
Yep. Here.
Excellent. We have you're happy with your catheters,
Yep. I've got those all in my
your
hand.
cathlons.
Yep.
We have IV fluid and tubing.
Yep. It's right
Excellent.
there.
And we have some ice if we take a venous gas.
Yep. It's there.
And something to document with.
A simple one-page documentation tool such as this one can be brought into the negative pressure room with the team. We will highlight the importance of this document further along in this video.
Our assignments.
Yep. I've got the bag of our assignments here.
So again, we've developed a pre-made pack and we'll go over that later further in this video.
Let's actually quickly talk about those right now. Through debriefing and feedback from many simulation sessions, these grab-and-go bags were developed. Each bag contains all the materials required for each team member to complete their relevant tasks. This not only helps to reduce cognitive load on team members, but it also helps to reduce waste of materials.
And we have our post-intubation sedation and analgesia.
Yes, we do.
Excellent. In our ante room, we'll keep one walkie-talkie, and we'll actually give that to our ante room team now, so they have it. And we have our arterial line, ABG syringes, again, kept all in this blue container for when we move forward. We have our Foley catheter kit as well in this blue container. And outside the room, we have our med card if we need it. We have a walkie-talkie for our outside team. I'll give that to Tina as our secondary RT outside the room. We have an IO gun. Yes, we do.
Yep.
And we have a triple channel pump if we need to bring it in the room. We do.
It's
Check.
close by. Yep.
Excellent. Thank you. So now we've prepared ourselves, our team, and now we're ready to don PPE. Again, for the purposes of this video, only Lacey will get in PPE. The rest of us will stay in scrubs or street clothes, again, to preserve PPE. So Lacey's going to put on PPE. The rest of us are going to stay as is. And Jacqueline is going to act as a spotter. Spotters are extremely important in this situation for both donning and doffing to make sure we're doing it correctly. So take it away, Lacey. Lacey's going to put on her mask.
You'll notice that we are not using N95 masks in this situation. By doing this, we do not waste valuable PPE materials. You'll notice that Lacey still undergoes a mask fit check as if she were wearing an N95 mask.
Again, in this situation, we're using surgical masks.
Absolutely. Yep.
And as you can see, she did a mask check before putting on any kind of gloves.
Got a little bit of hair sticking out right over here. Perfect.
For video and simulation purposes, we are using the reusable gowns as you see here in the video. If this were a real-life situation, we would recommend a level 2 disposable waterproof gown.
It's good to do this at whatever institution you work at to discover whether you're long-armed or
Perfect.
broad-shouldered to make sure
Yep.
you fit the gowns properly.
There's no tie. Okay. Well, let's pretend your back is you're good. It's tied.
And that just highlights the example of why it's good to try the gowns on to make sure all the ties are present. So you have our goggles, face shield. And last, Lacey's going to put on her gloves. Typically for aerosol generating medical procedures, it varies. We're recommending double gloves. In this situation, we're going to use one pair.
Yep, you're good. Your cuffs are up, nothing showing. The only thing is the neck, but we'll be mindful of that. Nope, it's good.
Team of 3 that's going in the negative pressure room. So that's myself, Jacqueline, and Lacey. Guylaine and Mike will be in the ante room. The secondary intubator can play a huge role in this situation. They can confirm that we haven't missed anything on the checklist. And of course, if we run into any problems in airway, we would ask that they step in and help us out. Same with the second RN. If the patient unfortunately has cardiovascular collapse or becomes sicker, we have an extra pair of hands if we need them. Now our team's ready. We're going to get our cart. We're going to drop off our blue anteroom box and our clean blanket for later on after we intubate the patient. The rest we're going to bring in the room with us. We've got a walkie-talkie for the inside team, a walkie-talkie in the anteroom, and a walkie-talkie for the outside team. Is everybody ready? We're happy with our PPE. Is there any questions from the team?
Nothing for me.
No questions.
Everything's
All right.
good.